Michigan has a 140-bed mobile field hospital that is critical to use in situations similar to the tornado that took out Joplin, Missouri, where the hospital was destroyed. So this resource can go into any area in the state of Michigan and supplement the local community that is without a hospital. So today we're testing how that would work. Spectrum Hospital Big Rapids has simulated that they were hit by a tornado, so they brought over 100 staff for training using a field situation, an austere situation. And we also have across the state mobile field teams. So mobile field teams have come in and are also training on the resource. Because we have limited funding, we only have one mobile hospital, but we need teams of staff across the state, volunteers, physicians, nurses, EMTs, etc., that would staff in the situation of an emergency. Okay.
Are we able to get
and I think they already put that in, but we don't know.
We also have pieces, because it's compartmentalized, we have smaller units that will go out routinely, and pieces of it that assist with, for example, the Detroit Marathon. They'll use some of the equipment that's part of the mobile hospital to assist the runners along the way that get ill. Today we have set up our command posts, so that's where the operation is run through. It's set up similar to a hospital, so you've got an entrance to emergency room where people are triaged and taken to the appropriate areas within the hospital. We have set up like wards for the hospital where people are treated for minor injuries, given maybe perhaps IV fluids or medications. We do have, when the whole hospital is set up, there's a pharmacy unit, there's a small pediatric ward, etc. So it's really set up with the same areas that you'll find in a hospital.
This is Simman 3G. This gentleman will blink at you. He can sweat, he can seize, he can turn blue. You can listen for heart sounds, you can have lung sounds, you can make him sound like he has congestive heart failure, you can do all kinds of things. He's now having a seizure, and he's groaning for you. You can come on up closer and take a look if you want to. He'll foam at the mouth, he'll do all kinds of things. When I trained, you went and you trained on people. And you were a student and you went and trained on people and you hope you didn't hurt them. There's no real reason to do that anymore. With these kind of mannequins here, we really want to be able to train people on mannequins, and these are fairly lifelike in a lot of ways. We can put chest tubes in these, we can do trauma. We can do a lot of things with these mannequins that are very beneficial. You
really can't do anything in life, just step out of the door and all of a sudden you're proficient in whatever it is you do. Doctors and nurses routinely treat patients, so this is what they do on a daily basis. They're very proficient in that, but they really don't do basic disaster, advanced disaster life support. It's not something they would do on a routine basis. So unless you train and you exercise and use the resource, we don't want anybody to be surprised when they're mobilized and not know what they're doing. And I know as a patient, if I were a patient, I'd certainly want my physicians to be trained how to use the equipment that's available for use. But we're really thankful for all of the volunteers and all of the great physicians and nurses and medical personnel across the state of Michigan that volunteered their time to come here and be ready for any sort of emergency preparedness event.